So breast cancer is quite common throughout the world and in Malaysia as well. Some of the risk factors includes age, hormonal factors like the age of menarche, which is when the lady first had her period, lifestyle factors, and even our environmental factors. So those are the factors that we all have, and some of it we cannot change. So for example, we cannot stop aging. But there are also some other risk factors like an inherited risk factor, and that's for a smaller proportion of individuals. And in these individuals where they have an inherited predisposition, meaning they're already born with an increased risk due to genetic changes that they may have, then their risk would be much higher than the general population. So those generally are the risk factors for breast cancers. So as a genetic counsellor, we look into the individual's type of cancer. So even within breast cancer, there are many types. So we pay attention to certain breast cancers like triple negative breast cancer, the age of onset, meaning the age of which the cancer has happened, and whether the person has more than one breast cancer. Sometimes they have bilateral, meaning both breasts will have cancer. So those are some of the pointers we look at in the individual. Secondly, we will look at the family as well and what's happening in the family tree. So if someone has relatives that may also have breast cancer or related cancers like ovarian cancer, prostate cancer, or pancreatic cancer, these are some of the things that we look out for. They are like clues that will help us estimate what is an individual's risk for breast cancer, and it's also other associated cancers as well. The genetic counsellors work closely with the patients or their family members, and through the various clues or points that we find out, then we will assess to see whether a genetic test, which is to look at changes in a person's genes, whether a genetic test would give more in-depth information about that individual's risk to breast cancer in particular.